We call upon Dr. Purnima Tandra, Clinico microbiological profile and treatment outcomes of actinomyces odontoliticus keratitis.
Good morning everyone, I'm Dr. Purnima. Today I'll be presenting the clinical microbiological profile and treatment outcomes of actinomyces keratitis. So actinomyces are true gram-positive bacteria that are facultative, anaerobic, non-sporing and non-capsulated non-acid fast filaments. In culture, they form like a branched network of hyphae, hence it is also called as ray fungus. They are soil organisms often found in the decaying organic matter. It is primarily a commensal microbe found in a normal oral cavity, in tonsillar crypts, dental plaques and carious teeth. So there are very few case reports that have been presented before. One is a case of indolent infection following penetrating keratoplasty with a classic appearance of infectious crystalline keratopathy. It was not recovered from the corneal scrapings or culture, but the histopathological diagnosis was made in this case. And there was one more case report with a delayed onset of actinomyces keratitis post LASIK procedure also, in which there was an infiltrative patch at the flap stromal interface and it was diagnosed microbiologically. So the need for the study here is that most of these cases resemble fungal keratitis. We'll see it as we proceed, and they have been treated as fungal keratitis initially in multiple circumstances, and there is a difficulty in identifying the organism microbiologically because it often mimics other organisms like nocardia, and there have been very few case reports. Coming to the aim of our study, we plan to analyze the demographic data, predisposing risk factors, ulcer characteristics, antibiotic susceptibility and treatment modalities and outcomes of all the patients with culture proven actinomyces odontoliticus keratitis. It was a retrospective case series. We analyzed the electronic medical records of all the patients with culture proven actinomyces keratitis between January 2017 and December 2021. So a standardized protocol was used in collecting the data for analysis. Coming to the demographic data, we had 9 cases of actinomyces keratitis, among which all were males. There were no female patients. And the age distribution, most of the patients, that is 6, were above 50 years of age group, 3 in 50 to 60 and 3 among 60 to 70 age group, whereas 1 each of less than 30, 30 to 40 and 40 to 50. So the predisposing factors that we analyzed in our study were history of fall of dust or soil in the eye as given by the patient in 45% of the patients, and a history of trauma with vegetative matter was found in 22%, and there was history of post PK in which the infiltrate was in the graft in 22% of the patient, and patient didn't give any relevant history in 11% of the cases. So coming to the ulcer characteristics, the mean ulcer size was about 13.99 to 14.55 square mm, with the maximum size of the ulcer being 64 and minimum of 1 into 2 mm, that is 2 square mm of area. Coming to the clinical features, these are 4 among the 9 cases that presented at our center. So as we can see, they either present as white grayish infiltrates with feathery borders. They are like plaque-like and slightly more defined lesion. There is also presentation with hypopyon, and there are endoexudates in one case where it is presented post PK. Actually, this is a very old graft, 5 years after the PK. So all these clinical features also resemble clinically fungal type of infection. So we did corneal scraping, sent for smear examination and cultures. We have sent chocolate agar, blood agar, SDA and PDA. So based on the antibiotic susceptibility, 34% of the cases were susceptible to ciprofloxacin, 22 to fortified cefuroxime, 22 to amikacin, moxifloxacin and gatifloxacin were 11%. So the ulcer, we have taken time from presentation to macular scar formation. So it was a mean of 41 days. Summarizing, there were 9 patients which were identified. Risk factors were trauma and failed graft. Most of them were white and had a dry looking appearance. Most of them were sensitive to amikacin and ciprofloxacin, followed by moxifloxacin. And 7 cases healed with medical management with a mean of 41 days. So this study is to re-emphasize the fact of need for microbiological examination in all the cases, even though there is the clinical appearance of fungus. Yeah. Thank you.